So one thing that hopefully we're all starting to do a little bit more of when working with patients is incorporating nerve glides. I think working on the nervous system is far more beneficial than working on certain muscles in isolation. And my honest belief currently is that muscles are pretty dumb. I think they're kind of do what they're told. So if we're saying that somebody has a lot of muscular dysfunction or muscular tightness, we really need to start kind of going through the layers of the body and figuring out where the signal is coming from for that muscle to become or be staying tight. Unless you're dealing with just a truly overuse issue or an athlete with just doing a lot of repetitive patterns, and we're truly just creating some overuse, wear and tear in that muscle tendon junction. For the majority of the people that is the population of physical therapy, I think that's just not the case. I think that when we're developing these overuse issues from just simple activities like walking or just your low level exercise, that there is a nervous system or joint component that is contributing to that muscle tightness. So I think nerve glides is often a great place to start if we're trying to utilize and work on the nervous system. So obviously the sciatic nerve being a big contributor to lower leg dysfunction. So if your patients are experiencing hamstring tightness, calf tightness, Achilles tendonitis, plantar fasciitis, all the itises, all the stuff going down the posterior leg basically, again, those muscles are receiving signal from the sciatic nerve. So we need to be looking up the chain. We need to be looking at the low back. We need to be making sure that the posterior hip musculature is clear of any nerve adhesions or anything like that. We need to make sure that nerve is gliding well. So a couple of the easy nerve glides that I really like to give my patients or work on myself kind of just stem from either yoga transitions or other exercises or stretches. They're just done at a different frequency or hold duration than we would typically do normal stretching. So one of those is kind of what I call a modified downward dog. So you're basically just getting on a bench height or low table, and we're going to start kind of in a plank position with the heels more down towards the floor. And all we're doing, if we kind of go from here and we almost move into a pike position, so we're pressing back, all of a sudden I've got a lot of tension down my sciatic nerve on both sides. So we're just transitioning through that. So I'm just going to push out and then come back, and then push out and then come back. And I'm doing a good job. I'm also keeping my core drawn in, especially if this is potentially a lumbar stabilization component. It's good to keep the core, the deep core stabilizers active while we're doing these nerve glides. So I might have a patient roll through 15 to 20 of these. You can certainly add a push-up in if you want to. And this is a pretty smooth transition here. Just doing that. It's a really, really easy way to get the nerve moving. And the way I kind of think about the sciatic nerve is in three components. I want to do a hip driver, a knee driver, or an ankle driver, depending on where those symptoms are most prevalent. So that would be a hip driver. The primary moving component there was my hips. If I was wanting to do a knee driver, it could be something as simple as this. If I'm laying down, I'm going to bring the thigh up, so now the hip is fixated, and the ankle's not really going to change, but I'm just doing a knee driver. I'm just letting the knee be the fulcrum point, and I'm just tightening the nerve that way. If I want to add some tension, I can straighten this other leg, or I could preset my ankle into more dorsiflexion, which is going to put more tension on the sciatic nerve that way. Or I could easily do an ankle driver where I fixate the knee either just at the point I feel tension or slightly below it, and then I only pivot at the ankle. And then that would now be an ankle driver. Hopefully as we go, we can start to move further and further up to feel the same level of stretch. Now there's a lot of other ways to do more functional knee and ankle drivers as well. Those are just easy to do. They keep the back relatively flat. And I think that hip driver in the beginning, that modified downward dog, is just a really comfortable transition. Also kind of gets the shoulders warmed up for activity. So try those out. I'm going to start posting a couple more options for nerve glides. They really have become a staple in the exercises that I give to my patients. And I just wanted to kind of share some with you guys, and hopefully you can start to use them also.